St. David's Healthcare confirmed today that one of its physicians tested positive for the coronavirus. Representatives didn't say how that doctor got the virus, but that it wasn't the result of a breach in protocol. They said that they will continue to follow best practices for preventing the spread of the virus.
But as KXAN's Yoojin found out, healthcare workers across Central Texas are getting extremely worried about not having enough supplies to do their jobs safely.
Dr. Kelly Gillette had to ask the community.
Some of these were dropped off at my house.
Because her office didn't have any N95 masks.
We definitely are better off than we were this morning.
And Dr. Gillette isn't the only one searching.
We are going to be out of those this week.
In Dr. Robin McCarty's office, they're getting creative with homemade masks.
Using pipe cleaners for the nose piece and baby diaper, cloth diaper to cover here, and having strings. It's not an N95, but it's better than nothing.
These doctors told us smaller practices are considered low priority, so these respiratory protective devices are basically back-ordered indefinitely. But even for places like Austin Regional Clinic,
we know that our masks are in short supply, and we know that we're having trouble getting those.
Doctors and nurses tell me the concern is not knowing exactly what's going to happen tomorrow, a week from now, even a month from now. They say they don't want to be in a situation where they've run out of protective gear and there's a sudden surge in the number of patients. They say healthcare workers need these masks so they can safely conduct flu or strep tests and see patients.
Once our staff members start to get sick, we will be able to see fewer and fewer patients, so we're doing our best to keep them safe.
Austin Regional Clinic says as it waits for the N95 supply to increase,
we are currently ramping up video visits, telephone visits.
Doctors also say do not stockpile N95s if you're healthy, and
everyone who has extra masks that they can part with, please donate that.
Yoojin, KXAN News.
The depleting supply of protective gear isn't the only challenge healthcare workers are facing. Yoojin also spoke with the Texas Nurses Association. They read us some comments that they've heard from nurses across the state.
I work at a hospital in El Paso, and the information changes every day regarding protection, how to use the necessary equipment. There's no actual plan when asked. Everybody says a different thing.
The association says that there needs to be clear, accurate communication from hospitals and doctors' offices to nurses and doctors. They say in situations like this, you can never over-communicate.
Well, if you've wondered why there's such a premium on those N95 respirator masks compared to others, here's the reason. Testing. It's all about testing. It's a big part of it. The government has approved and evaluated those masks for tougher jobs that surgical masks just have not been approved for. While surgical masks do protect the wearer, they are only fluid resistant. There are also openings at the edges, making it possible for airborne particles to still be inhaled. With the respirators, they're tight-fitting and can block out almost all small particles in the air.
And those supplies are crucial as researchers learn more about how the virus spreads. A new study from the New England Journal of Medicine found the coronavirus can survive in air particles for several hours. They say the duration depends on factors like heat and humidity and whether there's fog or dust in the air. They also warn that COVID-19 can stay in the air for hours during medical procedures where gas is used. That prompted the World Health Organization to urge healthcare workers to take extra precautions. Researchers also tested how long the virus lasts on different surfaces, and they found that it can last up to 3 days on plastic and stainless steel.